Mental health affects everyone, and sometimes you don't see the suffering. It's not obvious, and it's very silent. But I hope that with my work that I'm able to inspire patients and trainees that mental health disorders should not be stigmatized, that it can be treated effectively. My name is Kelly Lee. I'm a professor of clinical pharmacy and associate dean. I was born in South Korea, and I immigrated to the United States with my family in 1981. I grew up in Orange County for most of my life, and I went to UCLA for my undergraduate studies, and then I graduated from UCSF School of Pharmacy with a Doctor of Pharmacy degree in 2000. I was mesmerized by the Parnassus campus. Having never visited Northern California, it was a new world. First time living away from family, and just the city was so diverse. It was exciting. I chose to specialize in psychiatric pharmacy for a variety of reasons. I think one is that those with psychiatric disorders are probably one of the most marginalized patient populations, and I felt that if there's something that I can do to serve the underserved, that was my role. We need to make sure that they are not stigmatized, that they do get the treatment that they deserve. My goal is to ensure that patients receive the right medications for the right diagnosis and that they understand the role of medications. I think the joy of seeing a patient who came in unable to function and get out of bed, in a few weeks, they're out, about, and being able to work, I think that is the greatest benefit and joy that a clinician can have. San Diego is unique in that it is one of the largest cities in California, and we have very diverse populations living in San Diego. We also have a lot of refugees at the border. Mental health disorders affect people from all walks of life. There is no distinction between race, ethnicity, gender, socioeconomic status. When I read at UC San Diego, I saw an opportunity to provide additional enhanced psychiatric pharmacy services, and so then I established the first psychiatric pharmacist-run collaborative clinic in the outpatient health system. After establishing the clinic, I saw an opportunity to really provide the training to specialize in psychiatric pharmacy. And then I developed the first psychiatric pharmacy residency program here at UC San Diego Health. Most patients still do not have access to mental health services because of the lack of providers, lack of hospitals and services. And so we need to have more resources and more funding for mental health care. And we need to grow the number of providers who provide mental health care. I am very grateful for the training that I received at UC San Francisco School of Pharmacy because of not only the great faculty who are there to provide me the training and the knowledge, but the connections I made, the friends that I still cherish. I'm still recognized for that training, and that I continue to run into alumni wherever I go, and that we have a common bond of training up in Parnassus Hill.